So if you have like white coating on the tongue, so all of you now, if you are listening to me, just go check yourself in the mirror and stick your tongue out and look at it carefully. So if you have a little bit of white coating, that can tells you that, okay, this is mostly, it can go with dehydration, so you're not drinking enough water, or you have thrush, which is the candida, or basically it's a fungal infection. This is most common in people who are on an antibiotic for a longer period of time. So basically the antibiotic kills the good bacteria, and now, you know, the oral cavity, it's a very complex, but it's an ecosystem. So the bacteria, they live in harmony with fungus. So if you take antibiotic for whatever infection, and now the bacteria are like, okay, they're dropping down in numbers, now the fungal, you know, the fungus is like, okay, well, now it's time for me to thrive. And this is when you start to see what's called thrush, or candidiasis, or you know, when you stick your tongue and you see some white patches. And it's also pretty common in people who are immunocompromised. So, you know, people with a lot of medical problems, or people who are wearing dentures or partial dentures, that sometimes could be a big issue, especially if they're not taking them out. They have to. And I have patients who've been like married for like a zillion years, and they never ever take the dentures out at night, and they're like, nope, my husband should not know. And I'm like, okay, but they need to be taken out, because now the problem is your tissues, they need to breathe. So sometimes you get that oral thrush. So this is candidiasis, and how we fix it, you just have to go to see your dentist, and they usually give you like a prescription for an antifungal. And if you're wearing dentures, you have to soak the dentures in that solution as well. And of course, you like, you know, change it every day. But this is oral thrush.